Good morning, everybody. Dr. Bruce Guillory again with Health Source of Atascocita. We had a phone call this week for a new patient who obviously, in our line of work, if they're calling to be a new patient, most of the time they're dealing with some pain, acute pain or chronic pain. I really don't know which one of those two this patient actually had, but suffice it to say they had some pain. However, before they showed up in our office, they called back and they wanted to find out if we were going to prescribe for them some painkillers. Of course, as a chiropractor, one of the biggest reasons I got into what I do for a living is because I wanted to have the opportunity to help people overcome their pain without having to use drugs or surgery. Because undoubtedly, every time you put a drug in your body, there is a side effect. Whether you see it or feel it or not, there's a side effect. There's no doubt about that. Well, this person unfortunately canceled their appointment when they found out that we were not going to be prescribing any sort of medications for them, painkillers for them. Now, I don't know, maybe they had a real major pain problem. Maybe they have a pain medication problem. We know that happens all the time now in our country. And we've been speaking a lot at Health Source about the whole opioid crisis. And that just brought it home to me that unfortunately we have that mentality that says, I've got pain, so I need a painkiller. Well, the fact of the matter is the reason someone has pain, and let's speak about musculoskeletal pain because that's what I deal with. The reason someone has pain is not because they've got some kind of deficiency of hydrocodone in their body. It's not because they have a deficiency of some sort of muscle relaxer in their body. That's not the reason. There's a problem that's creating that pain. But we have this mentality that says, I've got pain, I need a painkiller. And that unfortunately is becoming a killer of people in our country. If you've seen any of my videos recently, you've heard me talk about the stats. 50,000 lethal opioid overdoses per year in our country, 20,000 of which are prescription-related opioid overdoses. Really sad, really frightening. So that kind of breaks my heart when I hear someone say that. And I want you to know it's not just adults that we need to think about when it comes to the opioid crisis. As I mentioned in a previous video, some of the larger prescribers of opioid medications are oral surgeons and dentists. And how many of you guys have had kids that have to have their wisdom teeth removed, or they've got to have some sort of dental work done? Well, many times they're going to be prescribed an opioid. My son's going to have wisdom tooth removed in December during the Christmas holidays, and they've already written a prescription for painkillers. Despite the fact that there's a lot of research out there that shows that use of ibuprofen and or Tylenol are really good at reducing pain from oral surgery type situations. And I'm going to tell you from personal experience with regards to musculoskeletal pain, we have people that come in to see us that maybe they were in a car accident or they went to their medical doctor first and they've been prescribed what I call the triple play. A painkiller, that could be hydrocodone, pretty common, a muscle relaxer, scalaxin, whatever, and some kind of anti-inflammatory, which is typically going to be ibuprofen. And it's called prescription strength ibuprofen because it's 800 milligrams per pill. Out of all the pills those patients take, most of them tell me that the only thing that makes them feel any better without drugging them up and getting them goofy is the ibuprofen. The other stuff doesn't kill the pain. It just makes them, like a lady that was in yesterday who had been in a car accident. She had been given a painkiller, I forget which one, and she says all it does is helps me sleep. It knocks me out. I can't take it during the day. And as I said, anyone who receives a 12-day supply of an opioid, I said this on a previous video, man, there's a 1 in 4 chance that a year later they're still going to be on opioids. Folks, that is frightening stuff. Man, what we get to do day in and day out of my office is so exciting. It's so much fun because we're helping people handle their pain without any drugs, without any surgery, and without the side effects of addictions and other horrible things that occur from taking medications on a consistent basis. Remember, here at Health Source, we've got a really special thing going on all the way through the end of November. If you're a new patient at our office, for a $20 donation to the Salvation Army, because they have drug addiction treatment centers that we're trying to support, a $20 donation to the Salvation Army we'll get you a complimentary consultation, an examination, and a 10-minute chair massage in our office. So share this video with some of your friends. Give us a call, 281-852-5600. If you know someone that's dealing with pain, or if you yourself or a family member is dealing with pain, give us a call and use that special promotion and help us fight back against the opioid epidemic. Dr. Bruce Guillory, again with Health Source of Atascocita.